Hey guys, Dr. Andy here today. Today we are going to talk about core stability, and that is stability for the low back, okay? The reason why this is so important is because probably the number one correlation that I see here in the office is anyone coming in with low back pain, almost always they have instability in their core, meaning they can't control their low back very much, okay? So I don't care how many sit-ups you can do. I don't care about the six-pack. I don't care about that at all. All I want to know is how well are you able to control your movement through your thoracic spine, okay? So there is 3 different movements that you need to be able to control. You need to be able to control flexion and extension, so being able to bend forward, bend backwards. You also need to be able to control lateral bending, so that means side to side, and you need to be able to control any kind of rotation, okay? So the 2 easiest ones that we've already kind of shown in previous videos that I can send you if you need, for flexion and extension, so bending forward and bending backwards, best thing you can do for that is planks, all right? So if you can get to a 60-second plank on your elbows, on your toes, then you have sufficient core stability going forward and going backwards. So that's what we're aiming for. If you can't do 60 seconds, start out with 20 and then do that 3 times and build up to being able to do 60 seconds, okay? The one for lateral flexion or lateral bending, it's just the side plank. So on your elbow, straight body through to your feet. I want you to be able to get up to at least 30 seconds per side, okay? So obviously if you can't do it 30 seconds per side, start with 10 seconds, do 3 sets and build your way on up, okay? What I haven't shown is core rotation, how to be able to control your rotation, okay? So we're going to use a band today. So if you have any bands at home, what I want you to do is I want you to make a big knot in one end and then put it in a door frame so that you're able to pull that band nice and taut and it won't come out and hit you, okay? So here in the office, we have it attached to the wall. You're going to take that band and you're going to pull it out nice and tight in front of you so that there's a pull. Obviously it wants to make you rotate in this direction, but you're going to resist against it. You're going to hold it out in front of you and don't move for 30 seconds, all right? The part of it is that you have to breathe completely normal. Can't hold your breath, okay? If you have to hold your breath in order to do any of these movements, well then you don't really actually have good control, okay? You can't do it normally, all right? So be able to hold a band nice and tight out in front of you, not over rotation, just pure out in front of you. Hold that for 30 seconds and you're going to do both sides, breathing normally. So if you can do a plank for 60 seconds, side planks on both sides, minimum 30 seconds, and then anti-rotations with a band, minimum 30 seconds on each side, well then you've got good core stability. If you don't have that, you need to work on it because you're at risk for hurting your low back. If you have any questions, send them our way. Always remember to live with passion and not pain.